Antimicrobial resistance doesn't have a face. You can go and tell a story from a cancer survivor, and you can tell a story from a community that has lost people due to cancer. But when you cannot see it, because there's no patient who will walk through the door and you can say that's an AMR patient, you have to do a raft of tests, and it probably doesn't show.
AMR is a big challenge for every low and middle income country, including Kenya here. We're talking about failure of treatment of most basic infections that would have probably be controlled or managed through an antibiotic. The worrying trend that would need addressing is where us as humans contribute to the increase in antimicrobial resistance. And that's where we can intervene. There has been a lot of usage of antimicrobials, but the problem has been that nobody does in the lab test to say that this patient requires antibiotic, this one doesn't require. It's usually a wholesale use of antibiotics for prevention of secondary infections.
There is definitely a gap in terms of data. When you don't have concrete data, then making decisions becomes a problem. You cannot make policy decisions sometimes without local evidence.
The other issue we need to tackle, especially at the level of policy, is for us to be able to put money where our mouth is. We must be able to assign resources to tackle this problem of AMR. It's not just about the Ministry of Health, it's not just about the central government, but it's about communities, it's about counties, it's about health facilities, that they need to discover that dealing with AMR starts with me. It's a slowly progressing pandemic. And when it reaches the peak, we may not have alternatives at that time.